With the springtime here, I think it's fair to say all of us are eager to get outside and enjoy the beautiful city that we call home. But for many people, if you're struggling especially with arthritis, you have hip and knee pain, that can be a difficult time to live the life you want to. So we have help for you this morning. We've left the studio and headed over to talk with Dr. Josh Lawson. He is with Orthopedic Surgical Specialists here in Chattanooga. Good to see you.
Hey, Julie, thanks for having me.
And it's really kind of nice, I think, the approach that you seem to have at your office for your patients when they come in, because it's almost an old-fashioned idea where they're actually going to sit and talk with you.
Absolutely. We structured our practice so I can spend time with the patients. Every patient is seen by me at every visit. There's no mid-level providers in our practice, so it's a one-on-one conversation with me and the patients to really educate them, learn about their condition, their goals, their individual, and it kind of individualize their treatment plan around their goals to get them the outcome they're looking for.
It's possible that while you're here too, you'll end up having a conversation about, oh, did you know? Because you're a Chattanooga native.
Absolutely, yeah. I was very proud Chattanooga native, born and raised here, graduated from Hickson High School. I'm also alumnus of Lee University right up the road and the University of Tennessee College of Medicine. I've been back in town now for a little over a year and a half, since 2019, after completing my orthopedic residency in Milwaukee, Wisconsin, and then completing a dedicated specialty year in hip and knee replacement surgery with Dr. Art Malkani in Louisville, Kentucky.
So let's focus on that specialty that you have, because you do focus on the hip and knee. Knee is a pretty common complaint around here, right? Arthritis in your knee can be crippling.
Absolutely. Knee and hip arthritis both. You're right, knee is about twice as common as hip arthritis. It can be very debilitating. It really limits patients' quality of life, ability to get out and spend time with their grandkids, do their hobbies such as golf, tennis, hiking, and we really have great surgical solutions now if non-operative management fails to get you back to enjoying that quality of life you've learned to love.
I think what probably stumps a lot of people when they're talking with their physicians is that it's hard to judge pain. You can't see that, right,
Correct.
as a doctor, so you've got to know how to really listen.
Definitely. Pain is definitely a individualized experience, and we've learned a lot about it over the last 10 to 15 years. And hip and knee replacement surgery historically has been accompanied by stories of excruciating pain for weeks on end, and it scares a lot of patients off from this beneficial procedure. But because we know more about it, we're able to take a more customized approach. We use different options to control pain, whether it's nerve blocks, where we numb up specific nerves around the knee or the hip. We inject numbing medicine into the tissues during the surgery to help with postoperative pain. And we have a lot more medications that treat pain in different ways that helps keep the pain under control, allows people to recover faster, and get back to enjoying their life a lot faster than they used to.
You know, this has certainly been a strange year in your profession.
Definitely.
Certainly. The fact that the technology has come so far, the recovery time is so much shorter now. Did that help a lot of your patients go ahead and get these replacements? Because often you have it and you're home the next day.
Absolutely. So, historically people would stay in the hospital for, up to a week or longer. You're looking at recovery times of months on end. Now, because of these improved pain control options, our techniques are less invasive, such as a direct approach for hip replacements, direct anterior approach for hip replacements. Patients are able to recover much quicker. It's maybe one night in the hospital. A lot of young, healthy, motivated patients are able to go home the same day. And that's been great this past year because all the fears of COVID and things like that, being in the hospital, being exposed to it, it allows people to get back to their home, their comfortable environment much quicker.
You probably do think more than anybody that age is just a number.
Absolutely.
I'm sure you see people coming into your practice of all different ages, but you can be 82 and still be a go-getter.
Absolutely. And we're doing these surgeries in patients that are much younger because the implants are better, the technology is better, they last longer. So it's not uncommon to see some people as early as their 40s to get this done. And if you're still active and healthy, even up into their 90s. The oldest I've done throughout my training was actually 100 years old.
Wow.
Because she was still living on her own, still driving, and benefited from that procedure.
So let's talk to the young whippersnappers out there who are 62, right?
Yep, absolutely.
They're beginning to feel it a little bit. Is your first line of defense really to try these other techniques first?
Always, always. So usually the first line is anti-inflammatory medications, physical therapy. We can do steroid type injections in the knee. We can do what we call gel injections or viscosupplementation injections that help kind of re-nourish the cartilage. And Also accompanying things like weight loss, healthy diet, stopping smoking, all those type things can help with knee and hip pain. And when those options fail, that's when we have that serious discussion about surgery.
So here we are on the most beautiful season practically in the Tennessee Valley now at our disposal. Are there some things that people can maybe do to ward off problems down the road? If you're an avid runner, is that going to wear and tear on you after a while?
It does. So the higher impact activities definitely take a toll on your hips and your knees. So lower impact activities such as swimming, stationary biking, or just outside cycling, long walks, elliptical type machines, anything that takes that repetitive impact off your joints is going to be better for you. How
about getting an appointment with you?
Absolutely. One of the great things with the way our practice is structured, we're able to get patients in quickly and at their convenience. The easiest way is you can give our office a call, or you can look us up online. You can also find a lot of our information online and make appointments through our website.
And people can self-refer. No
Absolutely.
need to have a referring
You don't
physician.
need a referral. Some specific insurance plans will require that, but if you call, we kind of know in advance which plans those are, and we can advise you if you need.
Well, we were not a patient today, but thank you for letting us talk to the doctor as well.
Absolutely. Thanks for being here. Glad you got to come by and see our office, and look forward to helping you and your patients in the future.
And watch for it in the future, because we're going to have another visit with Dr. Lawson in the days to come. We talked a little bit about his specialty training. He's one of the few doctors in the area working with a robotic type of procedure. We'll kind of get more in depth with that in a week or so here on 3+U, so you can hear about his training and what makes this so very beneficial. Here's the phone number and website for Orthopedic Surgical Specialists, Dr. Josh Lawson. Thank you.
Thanks, Julie.